It is not easy to talk about suicide, and quite frankly, perhaps there's not enough talking about the topic that really is very helpful. And the link between mental health and suicide. Some professionals say it's a complicated one and not necessarily synonymous with one another. And now a new CDC report reveals suicide rates are up nationally. Here in Georgia, 16%. And yes, we know there are all types of conversations, and obviously regarding the two most recent high-profile suicides. But I've asked a roundtable of mental health experts to come in and talk to me about what's not being discussed. I'm joined by Jesse Hennigan, a child and adolescent psychotherapist at Atlanta Mindfulness Therapy, Cipralata, a psychiatrist at In-Town Psychiatry and Psychotherapy, and Dr. David Purselle with Georgia Psychiatric Consultants and iResearch Atlanta. Also, we should note, while today's guests are experts in their profession, as with any segment dealing with physical or mental conditions, always consult with your own primary care physician, therapist, or counselor. Welcome to you all. Thank you for taking the time.
Yeah.
Thank you.
Thank you for having us here.
Let's begin with this response we often hear after a suicide. I didn't know that they had a mental condition, but that's not always the case. David, Doctor, I'll start with you. Dr. Purselle?
Certainly. Well, I think when we look at a lot of suicides, the typical thought is, well, I should have been able to see something. Why didn't I recognize this? And in many ways, other people will look at someone who may be closest to that person who died by suicide and maybe even cast some blame or try to assign some guilt. Why didn't you recognize this? And it's not necessarily something that's always going to be so immediately obvious.
Jesse Hennigan, what do you think?
Yeah, I mean, I think that often people don't know. They don't see the signs, either because the person is working so hard to keep it private, or because they think they're being clear that they're struggling, but not overtly saying it, and then people don't know. And I think often we tend to hope that people are doing well because we might not be equipped with how to support them if they're not.
Cipralata, what do you think?
So I think suicide is one of those things that is definitely, in a lot of cases, related to mental health and depression. They don't always go hand in hand, and I think one of the things that we are seeing as mental health issues, depression, anxiety, definitely put you at higher risk for suicide. But also there's a number of environmental factors that can happen that can heighten one's risk. And while as mental health professionals we try to address underlying depression and anxiety, definitely looking at those risk factors that are making someone higher risk is important as well.
The researchers found in that CDC report that more than half of people who died by suicide did not have a, quote, known diagnosed mental health condition at the time of their death. And I can understand, Dr. Purselle, someone saying, well, wow, that makes it even more, a little bit more astounding because they weren't even diagnosed with anything. What's your response to that they not having this, quote, diagnosed mental health condition?
Sure. Well, I think that really demonstrates a lot having to do with access to mental health, as well as the stigma that comes with mental health and many people just not pursuing treatment for being labeled mentally ill. And without getting proper treatment, it really can put you at more risk for further worsening of the condition, and with one of the ultimate outcomes of that being suicide.
And Jesse Hennigan, when we talk about, well, more than half of the people who died by suicide did not have a known diagnosed mental health condition. What are your thoughts on that?
I think that mental health conditions are drastically underdiagnosed, and I think that often people who really are vulnerable and needing support do not get it, largely because of stigma, largely because of access to quality mental health care, and the fact that, it's easier to access information and means to attempt suicide than quality mental health care is a problem.
Cipra, your thoughts?
Totally agreed with what both Dr. Purselle and Jesse have said. There is the access to care issue, and then there's also the reluctance to access care, which is that people hesitate to talk to their primary care physicians about it for fear of being labeled crazy or fear of being labeled mentally ill, because in our society we do have still a lot of stigma against mental health issues.
And Cipra, let me stay with you because you mentioned something. Often when we have our annual physical, we're told to, ask your doctor about your blood pressure. If you're a woman, do I need to get the mammogram? If you're a gentleman, do I get the prostate, checkup? But how often do you think people consider, do I have to talk to my primary care physician about my mental state? We don't often go into the doctor for our annual to think about that.
Absolutely. I think primary care physicians have a lot on their plate. They are dealing with medical issues, physical issues, emotional issues, and, sometimes in a 15 or 20-minute visit, it's not easily brought up. It's not easily talked about. There needs to be a certain level of trust in the room, so there's definitely lots of barriers to those sorts of things being addressed.
Jesse Hennigan, what do you think?
Yeah, I absolutely agree. And I think that one of the things with many of the clients that I see who are adolescents or young adults, there's real fear about acknowledging this to an adult. They might acknowledge it more readily to peers or through social media, but to an adult is fear of really experiencing punishment as a result of this, like loss of access of activities or peers, being sent to a hospital. I think that there's a lot of fears about what they could experience if they are honest with that. And then also the fear of, what if I say and it still doesn't get better? There's kind of ultimate hopelessness in that.
Dr. Purselle, she talked about fear, and we go to the doctor. We want to talk about the physical ailments, but often we never talk about our mental shape, how we're doing.
Absolutely. And I think there's obviously several reasons for that. One, when we look at going just to a primary care physician's office, oftentimes, as Sipper said, that they oftentimes have a lot of things that they have to take care of in a short amount of time, and the mental health issues get pushed to the side. But I think there's also kind of a general uncomfortableness in dealing with folks with mental illness. You have somebody who may say, okay, so someone tells me they're depressed or they're anxious. What am I going to do now? Mm-hmm. And, hopefully they won't ever bring up that they're suicidal, because then what am I going to do? And I think in many cases, the question about, are you having suicidal thoughts, is not asked. Sometimes because people are uncomfortable asking it, but there's also a notion out there that sometimes if you bring it up, it might actually put the idea in someone's mind and put them at risk, which is the furthest thing from the truth.
And what you all have said so far, Rose, look, suicide is rarely caused by a single factor. So let's separate, if we can, symptoms and warning signs. And Dr. Purselle, how difficult is that to evaluate? You're a professional in this. Is it always easy to evaluate someone who just might be dealing with depression or severe depression?
Absolutely not. I think one of the advantages that we have as mental health professionals is that when people come to us, they know they're going to be talking about their mental health. That doesn't mean they're always going to tell us just how severe their symptoms are or how much impact it has on their life. And sometimes it does take a little bit more probing to really get them out of them. The other thing.
How do you do that? How do you?
Yeah, it can be difficult, yeah. But a lot of it comes with clinical experience and knowing what the warning signs are to look for, and being able to follow up on some of those. And ask some specific questions about, are you sleeping okay? Are you having a lot of anxiety? Have you had any major changes in your life recently? Because these are things that can really put you at risk. Drug, alcohol use are also major factors.
Jesse Hennigan, warning signs and symptoms?
Yeah, I think the things that Dr. Purselle just said, absolutely. And I think, too, is, when I'm working with a client that is experiencing some thoughts of suicide, that doesn't actually mean that they intend to kill themselves or even want to die. And I think then being able to, as professionals, tease out the differences. There's some subtle but very important factors that could influence if somebody needs immediate safety or kind of extra support that within a family system.
Are you able to evaluate that on the spot?
I think it's ideal if someone who already has the training and expertise and has the relationship with the client and family is able to do that, and also best knows what are their resources. If I'm working with someone who is experiencing suicidal thoughts and lives alone, feels really isolated, does not have access to any kind of support, or the people that they live with are really invalidating, they would need kind of some external supports put in place. Whereas someone who doesn't have access to any lethal means, doesn't actually want to die, is open with family and friends about this, and can have some support in more regular sessions, then that, those are ways to kind of look at it. One of the things for me that ends up happening is that if a client has already been admitted to a hospital and found it to be a traumatic experience, they are less likely to be honest about symptoms as they're experiencing because they don't want to go back to the hospital. And so then looking at what is the best way to keep this person safe, give them good quality care, and also keep them plugged into the good parts, of their lives, I think is an important part of care.
Sipper, so far I'm hearing how it can be challenging for professionals, and it could take time sometimes. So I can imagine how difficult it might be for the loved one or the family one or the best friend to be able to evaluate this.
Absolutely. I think that it is a difficult job when you have a family member or friend who is experiencing depression and anxiety to be able to kind of assess what is helpful here, what is not helpful here. And I think the biggest thing that we can do as friends and supporters is to continue to try to educate ourselves on anxiety and depression, to kind of start taking away the stigma, to start not seeing these as moral failings or character flaws, but actual symptoms of a medical illness that can be treated with the appropriate treatments. And so I think the biggest thing that we can do as family, friends, supporters is, get your loved one to a professional, to a primary care physician, to a psychiatrist, to a therapist.
And Dr. Purselle, I want to pose this question to you, and then we'll go around the table, because I can understand someone saying, you heard what Sipper say, if you're a family member of a loved one and you want to get them help, and then you hear, there's nothing wrong with me. I'm just a little down, or I'm, I have the blues right now. How do you counter that if you're that family member, or you're the loved one and you really are concerned? Do you just kind of let them, you still monitor them, or?
And that can be very difficult.
Yeah.
If someone really is in denial or really does not want to get in for treatment, it can be a very big task to try to get them in to get some professional help. I think having some resources, such as knowing about the National Suicide Prevention Lifeline, that can be a great resource, not only for people who are experiencing suicidal ideation, but also for family members who are concerned, because you can still call in and talk to a trained therapist that can really help assess and get some help out to you immediately if need be.
Jesse Hennigan, I want to pose this question to you specifically because you relate with a lot of youth and teens. Is it more difficult in terms of evaluating, just how severe, if you want to talk about severe depression, or if you want to talk about, are they in that suicide phase?
Right.
I hate that term, but is it more difficult with teens and youth?
Well, I don't know that I want to say it's more difficult, but it certainly can be complex because it requires getting multiple sources of information. I think that experiencing suicidal thoughts can be really, short-term, acute, kind of an impulsive thought process. And so if somebody had experienced that like 2 days ago when they're in my office, they're like, well, I feel better now. So no, I'm not having suicidal thoughts. But then without having access to information from parents, from friends, from a school, about what they're really experiencing, and being able to say, so I hear you're not experiencing that now, but you did yesterday. So let's kind of talk through a plan about, should it come back, what are your next steps, how to stay safe, how to access the support that's available, and then also really helping parents have those difficult conversations. So often I hear from parents that say, like, well, if my child knows that if they're upset about something, they can come to me, because they don't know how to initiate those conversations. And so a lot of my work is helping parents know how to do that.
And Sipper, I want to get your thoughts on this, because in that CDC report, it also indicated that Caucasian middle-aged white women, there was a significant increase in suicide rates among that population. Your thoughts on that?
That's an interesting finding. I think it's likely complex and multifactorial
Absolutely,
is a short answer. But I think, there are a lot of things that are going on in today's world. There's a lot of ways that we are being connected. And I think connectedness is a big thing to talk about with mental illness, depression, anxiety, things like that, which is that we have social media and we have all these ways of reaching out to people and having people reach out to us. But what we're also finding, at least what I'm seeing in the office with a lot of my patients, is that even in this very connected world that we live in, people are finding themselves increasingly isolated. And I think when people are isolated and they have the genetic predisposition, they have the environmental factors, they have either lack of access or reluctance to access, that's really where we start to see suicide rates climb.
And Dr. Purselle, I want to get your thoughts on this in terms of what we typically get wrong as it relates to the media when we're reporting on this. Because obviously when you have the two notables and then everyone's reporting on that, but I've also come to learn in the last few days that there's sometimes how we report on suicides can really give the wrong message. And it's okay if you want to let me have it, I'll take it for the entire industry. But what's our culpability in all of this as the media as it relates to reporting on suicides?
Absolutely. Well, I think there are a number of challenges with talking about a subject such as this. You look at some of the celebrity suicides; those are the ones that really get talked about. We're not going to talk about on the media, the vast majority of people who are dying by suicide that are not famous and that the public is just never going to know their name. But certainly those family members who live with them, their friends, they're devastated by this loss. And I think that when we look at some of the celebrity suicides that do get talked about in the media, it's difficult to really portray exactly what they were going through. Mm-hmm. And much of what the kind of the impression that gets taken away is, well, this person's famous. They have this great life. Why is it that they committed suicide? It just doesn't make any sense. And, I think that thing that doesn't come across when we look at the celebrities is what is in their private life, because they're just not going to show you that. Mm-hmm. They work in a very controlled setting that shows you just what you want them to see, what they want the public to see, and you're not going to see their day-to-day struggles unless they're going to be open about it and talk about it.
And Jesse Hennigan, every year on Closer Look we will address new reports as it relates to cardiac disease or hypertension. We always do a checkup. And I'll be honest with you, I think rarely, this may be our first full segment on suicide. Should we do more about awareness and campaigns in terms of what role the media could play in all of this?
Yeah, I always think that we need to have more in-depth, tough conversations that help people both understand and also know what to do. I think that those are really important parts of being informed and feeling like there's a sense of hope and support out there.
Sipper, so what are we not addressing enough in this whole conversation about suicides, where it's prevention or trying to evaluate the symptoms early? What are we missing here?
I think it's really this idea of normalizing psychiatric care, of not making it a thing that only certain type of people do or people with certain diseases do, but just like we go in for our annual physicals and we take care of our physical well-being, we really need to be thinking about what are we doing to take care of our mental well-being, what are we doing to be proactive, not to be sitting with symptoms for years, weeks, months, and then trying to treat it, but what do we need to be doing to be proactive about the issue.
Often when we conclude conversations on Closer Look, it's all about the next steps or moving forward, and listeners will recognize this next statement. What is your message out there for anybody listening? What is the message you want them to take away from this conversation? Dr. Purselle?
I think my main point that I would want to make is that if you are struggling with feeling sad or feeling anxious or having some mental challenges, get help. Don't let it get out of control. Approach your loved ones and talk with them. They can be a great source of support for you. And if you need to get in to see a professional, absolutely don't hesitate to do so.
Jesse Hennigan?
Yeah, mine would be that there is absolutely hope and a good life after our darkest moments, and that if you are struggling, to please say something. And if you're the person being told that someone is struggling, to please respond with, thank you for telling me, I love you enough to get you the help that you need.
Cipralata?
So I echo the sentiments of the two people before me. I think the other thing that I would like to leave the listeners with is start talking, not only to your mental health professionals or to your primary care doctor. Start talking to your sister, your brother, your mom, your dad. Talk about your feelings, talk about things that you've gone through, because I think until we start having those conversations, this kind of big stigma that holds people back is going to continue to be an issue.
Cipralata, a psychiatrist at In Town Psychiatry and Psychotherapy. Jesse Hennigan, child and adolescent psychotherapist at Atlanta Mindfulness Therapy. And Dr. David Purselle with Georgia Psychiatric Consultants and Eye Research Atlanta. Thank you so much for coming in and being a part of this conversation. I really appreciate it. Thank you for taking the time.
Thank you for having us.
Thank you for having us.